Hi, my name is Carolyn Carey. I am one of the physios here at Calgary Core. My approach to treatment is liking to look at a more of a holistic approach with addressing the person as a whole. What are your priorities? What are your goals? And what can we do to help get you there? I decided I wanted to be a physio when I was in junior high. I was a soccer player growing up and had lots of ankle injuries and found myself at physio multiple occasions. And while I was there, I thought, hey, this is something I think I would like to do. I proceeded to follow that up and went to school at Dalhousie University in Nova Scotia and finished Kinesiology and Physiotherapy there and been working as a physio ever since. Starting, we do an assessment looking at kind of your general movement patterns, how you're presenting in terms of your clinical symptoms, but also maybe some other things that you might not have recognized are some imbalances in your movement patterns or old injuries or habitual things that have maybe led to the breakdown in the system. And then we start unwinding that. So whatever that looks like for the individual. It's not a cookie cutter approach. So you kind of got to take everybody as an individual and treat accordingly. I think some of the most rewarding things about being a physio is that you get that great interaction with people and you get to help them on their journey. And it's kind of a privilege to be a part of that journey for them. An elderly lady that I was seeing when I was a relatively new grad came in with a bicep injury. And one morning when she came in, she started telling me how she was losing control of her arms. And then I'm like, that's not really what happens when you have just a bicep injury. So we got her in with emergency care right away. And she was actually having transient ischemic attacks. So to catch that when it was missed prior and just sent to physio was a pretty good thing because she ended up being fine and proper course of treatment was taken. It was a bit more of a higher impact kind of moment. She was getting symptoms in her arm around her bicep, but it was not consistent with what the injury should be, what a bicep injury should be. When you come out of physio, you're kind of like a jack of all trades. You've got this big, broad base of knowledge. But then as you start to practice, you start to really find your niche and take more and more courses that kind of lead you along the path of what's important to you clinically and what you find is most effective for your clients in terms of helping them heal and helping them along their journey. So through that, because you're always taking different courses, there's different areas, then you start to bridge the gap between a few different approaches, different theories of thought, and then you can kind of put different pieces together to make a more complete treatment. I would say I kind of tend to do like a bit of more of a general orthopedic practice, but amongst that I've done some like looking craniosacral and myofascial. And so it's kind of maybe connecting some of the different systems of the body together, like not just looking at the nervous system or the muscle system, but also the myofascial system and even stuff in like the viscera and things like that, like how all these different parts of the body can contribute depending on the individual and manifesting in whatever array of symptoms they present with. My perfect patient is just ready to start their journey into wellness for them and what that means to them so that they're motivated to kind of achieve whatever goal, whether it be big or small, marathon or just like doing the stairs pain-free, whatever is meaningful to them, and that's going to get them to buy into the approach to get them their goals, not looking for the magic Band-Aid. I absolutely prefer one-on-one time with your clients so that you can give them the undivided attention they need to really get a good scope of what their symptoms are, how they're progressing, how they're responding, how they're feeling, and then you can make the proper modifications to make sure that the approach is working for them. I've been at Calgary Core for a long time, and one thing I can say consistently over time as a team, everyone really takes pride in high client care. Everyone really is invested in providing quality treatment and getting their clients the results they deserve, even if it means referring out to other people that will serve their needs better.